You be comfortable actually never getting a pelvic check? You hate getting a pelvic check and a pap smear, but what if you didn't have to get the pelvic exam in order to get the information? Hi, I'm your local OBGYN. I love women and let's talk about it. So traditionally what we know is that to get a pap smear, you have to get a speculum put inside of your vagina, and then the doctor or a practitioner looks at the back of the cervix and does some touching with some instrumentation back there. Literally just touching the cervix is enough to slough some cells off of the cervix that can then go swirl in a solution and be sent off to a lab. This is great. It really is a method of testing that works, but some people just hate pelvic exams. Now, in order to do an HPV test, you don't actually have to touch the cervix to get there because you're looking for viral information, which gets done in a very different way. So there is new testing that is going to become more and more available where you just literally stick a Q-tip up your hoo-ha, swirl it around almost like you put a tampon in, shoo, 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 and then put it into a little tube and send it off. It won't necessarily look at cells, but it will look at HPV. And if most of the problems of your cervix come from the HPV presence, if you know it's there or not, then you would be able to determine who actually needs further testing and or biopsies. This is great for people that have a lot of fear of vaginal exams, vaginismus, learning disabilities or developmental delays, who will not tolerate pelvic checks. And then theoretically, you wouldn't need as many exams, but would you be comfortable not getting an actual pelvic check?